my name is Meredith Kwok. I am the Assistant Director of Constituent Relations for the program in Public Health. Thank you again for joining us for episode 4 of the Public Health Lunchtime Lecture Series. As you may know already, the intention of this series is to inform and engage our UCI community in public health efforts happening right here in our backyard by highlighting the work of our faculty, whom are contributing to the COVID-19 response and beyond. All, of course, in an easy to digest manner if you're joining us over your lunch. This is a critical time for public health on a global level during the pandemic and also on a campus level as our program transitions to a school. Now, we know our time is short here together, so I'd like to introduce our first speaker in a minute, but just a little bit of housekeeping. Please stay till the end of the presentation. We will be using the Q&A feature on the bottom, and you can share some of your questions with our guests. Again, this is the Q&A function, not the chat. So please stay till the end. We'll have a short poll and some announcements to wrap up. So without further ado, Dr. Dominik Wodarz is a professor for the UCI program in public health. His research interest includes mathematical computational models of biomedical processes applied to problems in cancer, virology, and immunology. Through close collaborations with experimental and clinical laboratories, these models can be applied to data estimating crucial parameters, making testable predictions, and interpreting experimental or clinical data. These mathematical modeling approaches are based on evolutionary and ecological principles and are related to the general field of population dynamics. Dr. Wodarz received his BS in biology from Imperial College London and a PhD in zoology from the University of Oxford. Without further ado, thank you so much for joining us, Dr. Wodarz. I'll turn the microphone over to you.
All right, thank you very much for the nice introduction. I'm going to try to share screen. It's not doing it. Sorry, 1 second. Do it again. Okay, can you all see my screen? Good.
Yes, looks good.
Good. So thank you very much for the opportunity to talk here. I'm working on mathematical models of infectious diseases. It's part of my work, and so we started doing some work on COVID-19 as this epidemic emerged. And what I want to talk about today is some ongoing work that we've been doing. This is not finished work, this is work in progress, so keep that in mind. And it's concerned with using mathematical and computational models to interpret the data that are coming out, the epidemiological data. So I'm going to talk a little bit about modeling concepts, what models are, very brief introduction. Then I'm going to talk about some COVID-19 data that I think are puzzling. And then I'm going to talk about how we could interpret those data with the models and what one can say about opening up, which is sort of a topic of current interest. So these are, this is just an introductory slide of what epidemiological dynamics are. These are generally described by models that contain, they have different populations, susceptible individuals, infected individuals, and recovered individuals. It's called the SIR model. And what you typically observe is, if you look at the curve in red, the infection levels go up, they peak, they go down, and they go away. And they go away largely because most people have been infected, people have recovered, are immune, and the infection can't spread anymore. And these are, on the right, you can see data from flu-like illnesses that have occurred over the past, and they look very much like these predictions. So generally, these models are considered to be a good description of epidemiology. One of the assumption of these models are that people mix well with each other, so everybody mixes and meets everybody else, which is during social distancing not necessarily a good assumption. I'll come back to that. Let's look at COVID-19 data. So here the difference is that the infection does not run through the population uncontrolled and we wait until most people are infected and are immune. That definitely has not happened. What did happen is that people stayed at home, social distancing measures were put in place, and the infection was limited that way. And you can see that generally the dynamics follow similar trends as I just showed you. So the infections increase, social distances is put in place, the number of infections go down, as you can see here. This is New York, this is Vermont, very similar patterns to what I showed you. So there's nothing too unusual about that. But these are only some of the states, a couple of the states, and there are a few states when you look at the data that look like this, but if you look at other states, you see very different dynamics, and this is what I found puzzling about COVID-19. And what you see, let's look at the first graph, for example. You see the cases rising, then social distancing is put in place, and then the infection levels go to some sort of constant level. So these are the new cases per day, average over 7 days. So this is what you see roughly on a daily basis, new infections, and they stop changing. You get the same number of new infections every day over a prolonged period of time. And I call this a plateau. So in contrast to the previous set of data that I showed you, it doesn't go down in the same way, but the infection levels stay constant. So the number of new infections per day stay constant over time for quite a long period of time. And that's what I found unusual. This is not something that these standard models of infection spread predict. So the question is, what does it all mean? Let's look a little bit closer at these dynamics. So you probably heard about the reproduction number R. If R is bigger than 1, then the infection spreads. If R is less than 1, the infection levels go down. So the aim of social distancing is to drive this reproduction number below 1, so the infection is on the decline. What we observe in many of these states, many of these locations, is that initially R is obviously bigger than 1, the infection spreads, then social distancing is put in place, and then you go to this plateau. And what this plateau means that R is roughly about 1. That means that one individual gives the infection to one other individual rather than to 2 individuals, 3 when it would be spreading, or to less in this case it would be declining. So you get this reproduction number of 1 during this plateau, and it's a prolonged phase. And this occurs in many different places, in many different states, in different countries. If you look at county level data, you see this very, very often. And so this is very puzzling for me, because different places have different social distancing measures that are in place. And why would they all amount to the reproduction number being right around 1 and these new infections fluctuating around the same level? So that's something that I was curious about to explain. So looking at Orange County data to put that in place, these are a little bit more difficult to interpret because things have changed with the number of tests. On the bottom, you see the number of tests has gone up. If the number of tests go up, the number of cases go up, which doesn't necessarily mean that there is more spread. But if you look like early on, a little bit earlier, the stuff that I've circled in red, the number of new infections per day fluctuated roughly around the same level. So we see this same plateau dynamics in Orange County as well, so very relevant locally. So the question that I want to address is 2 things. How can we explain this plateau behavior? It's unlikely, I think, that many different places implement exactly the same intervention, that R is about 1, so there must be a different explanation for that. And also, when is a good time to come out of lockdown? What do these models tell us about what happens when you come out of lockdown at different times? So this is the framework that we've been studying. These are called network models, and these are different kind of computational models compared to the standard infection models that you routinely hear about. And they are different in the sense that these models keep track of individuals and their social connections. So each individual is characterized by a number of social connections that they have, which is the number of people that they meet. And then you simulate the spread of the infection across these contact networks. And there can be different contact networks. On the left here, what you call scale-free. This is a very highly connected network, which probably corresponds to a situation when people are traveling around. Everything is normal. On the right, which is a more local connection network, people probably stop traveling, but they're still connected locally to going around their business, doing their stuff. So you can assume different network structures. We don't really know how our society is structured. So this is an attempt to model this on a rather superficial level, but it's still interesting to see what kind of insights you get by taking account a model that tracks social connections per individual. So let's look at this sort of more local network. This could be interpreted as a network where people stop traveling around, but they're still doing their stuff normally on a local level. Then social distancing can be modeled by randomly cutting connections among these nodes in the network. So each node in the network would correspond to a person, and the lines from the different dots in the network correspond to social connections. So you can cut them in the computer, and you have something that's on the right, which is a network that has much fewer connections, which could correspond to what we do in lockdown. We mostly stay home, we maybe meet some essential people or your neighbors or something like this, and this is maybe a realistic description of social distancing. So if you take that model, you run a computer simulation of that model, this is what it looks like. So the blue line is just the number of infected people. It starts rising initially, as you see here. Then very early on, around this point here, if you can see my mouse, the social distancing is put in place. So the network connections of the people are cut, and then we let the simulation run. And what you see is that you get this plateau phase here, just as you see in the data. The number of infections remains kind of around the same level for a long period of time, but then over time, eventually the infection levels start to decline. And the interesting part in these simulations is that eventually the infection levels start to decline just by themselves without any further increasing in social distancing. So in this simulation, we change social distancing once. We implement it at around this point here when it's at the peak. And then we just let it run, and there's no more change in assumptions of how many people stay at home. It's the same number of the same behavior keeps being implemented, the same network connections. And so interesting, without any further increase in social distancing, this plateau eventually transitions into a phase of decline, and it goes to ever lower levels. So this is something that we found interesting and relevant to the data that we're seeing from different states and different counties, and so on. So what is an explanation of this phenomenon? So the explanation is the following. Here on the left, you have the original network. Again, you have the different dots. These are individual people that we track in the computer simulations. They're all connected locally. They're interacting with each other quite well. That's before lockdown. This is the description of before lockdown. After lockdown, we have a cut network where we cut the connections. So the different dots are much less connected now. Some have no connections at all. These are people who are staying always at home and don't interact with anybody. Others have some connections. And so if you just randomly cut the original network and you get the social distancing network, the lockdown network, what you observe and what you see quite clearly here is that you have some sort of highway. It looks like kind of connection highways that are one-dimensional in nature. You can see these paths here, and the infection would have to spread along these one-dimensional paths. So in the original network on the left, you can see that it's much more two-dimensional. You can go anywhere, any way, any direction, and you reach different people in a relatively easy way. Here, you have to the infection has to progress from one person to the next person to the next person along these one-dimensional connections that you see. And I think that can explain this plateau, the constant number of infections, because if you look at these one-dimensional highway, this is the schematic down here. These are squares, are people along this one-dimensional highway. Blue is uninfected, red is infected. We start out with somebody who is infected in the middle. So who can this person infect? It can infect their neighbor. This person can infect their neighbor. So next time step, you have not one infection, but 3 infections. So 2 more because you infected your neighbors. So now this individual in the middle is connected to 2 people who are already infected. So this individual cannot pass on the infection to anybody anymore because these guys are already infected. So only the outermost, 2 outermost individuals can pass the infection to their neighbors, and you get 2 more infections. Now you got 5. And similar here as well. The ones on the outskirts of this row can infect their neighbors, which is again 2. So you're going from 1 to 3 to 5 to 7, and every time you can only increase the number of infected people by 2. There is just no other way logistically, given that this is a one-dimensional array of people. And we think that in some sense, social distancing reduces our network connections to something that looks similar to a one-dimensional array of people. Of course, that is an exaggeration, and this is not completely a one-dimensional highway, but it resembles it to some extent, and this could explain why we see this plateau. So another interesting thing is you can start your distancing at different times, and this is what's shown on this big graph here on the left. The blue graph here that I'm showing with my mouse is the one that I showed you before. You implement social distancing here, and then you've got this long plateau, eventually goes away. You start later at higher numbers, you see less of a plateau, it goes down more. If you start at the highest, you don't see any plateau, and it goes down quite fast. Okay, so you can see both the dynamics where it goes up and down without a plateau, and this typically occurs in simulations when we implement social distancing rather late, when the infection has already spread, or you can implement social distancing much earlier, and then you see this prolonged plateau. And interesting, you can look at the data, and this seems to be borne out in the data. If you look at California, California implemented social distancing quite early, and they're going along this plateau for quite a long time, maybe increasing a little bit, probably not because there are more tests, but this seems to be a plateau. New York, on the other hand, it was let run for quite a bit longer before serious measures were put in place. So it spread much more extensively. And then it also declined without much of a plateau. So we think that this is consistent with the predictions of the model that we analyzed. So basically what this says is the plateau comes out of these network dynamics, and the plateau is observed if you start social distancing early and prevent much spread in the first place. And if a lot of spread occurs before social distancing is implemented, you do not see the plateau. And we think that's reflected in the data that we see. So to finish up, the big question, when should society open up? And I do not have an answer to this, but I can tell you what this model predicts, which may or may not be correct, because models always depends on assumptions, so one has to always keep that in mind. So on the left-hand side here, you see a simulation where we let this run as before. It goes to the plateau, and then we stop the social distancing at various times, and that's when you see a second wave of the infections coming up. So here you stop quite early, it goes up to quite a large peak. Here you stop social distancing a little later, it goes up to still the same peak. If you stop here, it also goes kind of to the same peak. But at some point, if you wait long enough, the peak of the second wave declines and declines and declines. And basically, what you have to do to observe the decline in the peak of the second wave is you have to follow this plateau along. If you are on this plateau, you have to follow it along until it naturally starts decreasing. Infection levels start to decline. Remember, I told you the simulation suggests that the infection levels will decline by themselves. Once you follow that plateau for a long time, it will transition to a decline phase. Once you transition to the decline phase and then you let go, you have significantly lower second waves. And so on the right-hand side, let me just go here. On the right-hand side, this shows the cumulative number of cases. If you stop distancing too early, you go to a total number of cases that's rather high. But if you wait until the total number of cases declines, your second wave will be lower and the total number of infected people will be lower. So where are we now? I think in Orange County and California in general, we're still in this plateau phase. That's what I'm putting here as the arrow. And if we stop now and we're to some extent relaxing social distancing, we're still in the phase where we expect the bigger second wave to happen. If we, according to this picture, if we waited for longer, we could improve the situation and prevent such a large second wave. But these are just predictions from a model. This is a model. We don't know to what extent it really corresponds to reality, but it's an interesting suggestion to think about that. Okay, so with that, I want to finish up. This was done in collaboration with Natalia Komarova in the math department, and we have been in discussions with the UCI Surge Group led by the public health dean, Bernadette Borden-Albala. And these are the people who are part of these discussions who definitely contribute to our thinking. So with that, I'll be very happy to take questions. Thank you.
Thank you so much. Wow, that last graph was fascinating and a little shocking. I think you would recommend that we don't hit the beach this weekend.
Yeah, well, I don't know about the beach. Outdoors is probably better than indoors, but I think we could gain something if we waited a little longer, if we were a bit more patient. The thing is, there's a lot of economic consideration, there's economic damage being done, but at the same time, if one is too short-sighted, I think one can get a worse outcome, not only in terms of public health, but also in terms of economics, because if it surges to a bigger degree, you got to shut down again eventually, and that's not good.
Slow and steady.
Yeah.
So we do have a number of questions coming in, Dr. Wodarz, if you want to take a look at the Q&A
Yes.
feature here.
So one question is, in these models, does repeated social distancing over waves of infection reduce overall mortality compared to no social distancing? So I have not talked about mortality, and the reason I have not talked about mortality is because it depends on other things than these dynamics. So it depends on the age structure of the population, the demographics, to what extent the hospitals get overwhelmed. So that's a very complex question. I think in general, if a second wave is reduced, or if the infection levels are lower, you probably expect a lower mortality, but there are so many complicating factors involved in that. If you just compare different countries, different places, like Germany, very low mortality, Italy, very high mortality. It's really sort of, it's difficult. So that's why I haven't put it in explicitly. So I hope that answers this to some degree. Another question is, how good are these models at accounting for super spreading events? They are sort of in there because in these networks, different people have different connections. So there are quite a few people who have very limited number of connections, especially during social distancing. But then there are other individuals who are much more highly connected. And these could be super spreaders. These could be people who work in the healthcare system, in the hospitals, maybe in supermarkets, and so on. So to some degree, that's in there. But we really need to have a better understanding of what these super spreading events are and what exactly drives transmission in which ways. There's still many unknowns and uncertainties there, but that's a very good question.
There's a question from Emmanuel asking to explain how you built your network and how you've pruned the edges during social distancing.
Right. So there are different types of networks that are supposed to correspond to various ways society works. They are published, they are known. And so you can build these networks with software such as Mathematica. It knows these networks. There are scale-free networks, there are spatial networks, they are small world networks. So this is the type of network that there is. So you can randomly build one with the software, and then doing social distancing, we did the simplest thing, and we randomly cut a number of connections, and you can cut them to various degrees. You can cut half of the connections, more than half of the connections, and you can explore how the amount of cutting impacts the predictions, and we're doing that at the moment. So that's basically how we do that. The question, will the phasing that California is doing help keep the second wave at a lower rate? That's a very practical question. What I'm doing is a model, and what that model says is that if we waited a little longer, we're still in that plateau phase, I think. If we waited a little longer until we see a decline, we would have a better outcome if we stop social distancing. But there are other considerations as well. Obviously, economic considerations are important, have to keep that in mind. And also this is a model. It has assumptions. Model predictions depend on assumptions. We don't know to what extent this is right, where we've gotten things wrong. I mean, we always have to keep that in mind with any modeling study, really, with any predictions one makes. And there are things that we don't know about this infection. If you look in places that have relaxed social distancing so far, we don't see an evidence of a second wave coming quite yet. We don't know why. Maybe one explanation is that people are still staying at home despite businesses opening because they're afraid. That could explain it. But we basically need to know a lot more about what really goes on data-wise. Okay. How accurate does the contact information need to be to understand the trends? Well, in principle, one could make more accurate contact matrices, contact information. This is very hard to do. At this stage, I think the results that we have derived are pretty robust in the sense that if you cut connections, it transfers to these sort of more one-dimensional transmission highways. We have seen the same results in many different types of networks that we have looked at. We have looked at more than one, and we see pretty much the same thing across different networks. So that gives me confidence that we're onto a more general trend here. If we can make more specific contact networks that correspond to specific societies, that would be better, but that's also very, very hard. I don't know even whether that's possible, whether we understand enough of how society works, whether this is possible. How do we know that differences between states reflect difference in social distancing practices and not pre-existing differences in the structure of the social networks? That's another question. That's a good question. Comparing different states is a very tricky thing. Societies can be different. New York is certainly different from Orange County. Also, the numbers, comparing numbers is very tricky because different places test at different rates in different ways, and that influences the numbers. So one has to be very careful when comparing different places, essentially. Does that answer? Let me see. Yeah, there could be pre-existing differences, I think, in the structure of the social network that determines those differences in dynamics that you observe in different states. That is true and correct, I think.
I think a good one to end on is the very last one, maybe not last, they're still coming. From Victoria, she's asking, are there any papers or published mathematical models that you would recommend that this audience looks into further?
Oh, that's actually the most difficult question. Because the reason that this is the most difficult question is while this infection is spreading at a fast rate, sometimes the number of papers that are being published or at least put on a preprint server such as bioRxiv or medRxiv, they're spreading at an even faster rate. So there's enormous literature emerging. There are many models out there that are looking at different things, lots of predictions. A lot of them are not necessarily correct. So I don't have a specific paper to recommend off the top of my head. If you want to email me, I'll be happy to dig something out. But it's always really important to know mathematical models, even they're not necessarily very good at being a crystal ball and predicting what's going to happen in the future, because we don't understand quite a few things about this infections, but they help us interpret data, they help us understand how this spreads, and they're very useful in that way. So that's something that is important to keep in mind. But please email me if you want to have specific recommendations.
Well, thank you so much. The end of these lectures always come too quickly, but thank you everybody for joining us. As always, a follow-up email will be sent with links to more information on ways to support the program in public health, our researchers, and UCI's COVID-19 response. I am releasing a quick poll here as well. Thank you. And just a few short announcements. Next Wednesday is UCI's 4th annual Giving Day. That is June 3rd. It is a one-day virtual fundraiser where all members of the UCI community come together. So please consider making a gift of any size in support of the program Public Health, our research, and our student experience. And then a week from today, save the date for our very last and bonus episode of Lunchtime Lectures. That's June 4th at 12:30. This is featuring Dr. Andrew Noemer returning for a 30-minute Q&A. So registration and more information on Giving Day will be sent in the follow-up email. Thank you again for being with us. Thank you, Dr. Wodarz, for sharing your experience with us. That was fascinating. Thank you.
Thank you so much. Thank you.
And thank you everyone for being with us. Take care and be well.
Yeah.